Hello everyone, welcome to the video on GPAT 2022 answer explanation series. I have made already a part 1 related to pharmacology and this one is part 2. The questions which are given in GPAT 2022 are explained in detail in this video. This is my YouTube video. If you like the video content, do subscribe and share. Let's get into the topic. See, the up and down method for the projected LD50 determination is described in. See, these are the OECD guidelines. Now you need to understand LD50 is lethal dose 50, the dose which is required to kill 50% of the subject is known as LD50, lethal dose. Now you need to understand what is this up and down technique is. See, in up and down technique, a particular dose is given to only one animal. A mice is given a particular dose. If the mice survives the dose is increased. That is, dose is up. If the mice dies, then the dose is decreased. This is called down. Hence it is called as up and down method. So in this method, the many mice are not used, only a single mice is used. A particular dose is given. If it survives, the dose is increased. If it dies, the dose is reduced. It is to determine lethal dose. And this is described in OECD guidelines of 425. These guidelines are given in OECD guideline 425. So this is the answer. Moving to the next one. Now the quadruple therapy of Helicobacter pylori infection includes. See, this H. pylori especially causes peptic ulcer. See, one of the reason for one of the causative organism for peptic ulcer is Helicobacter pylori. To treat this, quadruple therapy means quadra means four medications are given. And among these options, we need to find out which is the best combination. Now, bismuth subsalicate is an ulcer protective agent. It forms a coat over the ulcer and tries to control the aggression of acid and heals the ulcer. Now, metronidazole is an antibiotic which is acting against this Helicobacter pylori. Again, tetracycline is also an protein synthesis inhibitor which is acting against Helicobacter pylori. And proton pump inhibitor will reduce hydrochloric acid. So this is the best combination to treat peptic ulcer caused by Helicobacter pylori. Let us understand the other options. See, streptomycin, no, it is only used to treat tuberculosis because of its severe adverse effects. So this is ruled out. Sulfasalazine, again, sulfasalazine is a specific drug which is used to treat ulcerative colitis. It is not used to treat peptic ulcer. Now the other one, bismuth subsalicate, metronidazole, again azithromycin is used to treat upper respiratory tract infections but not to treat peptic ulcer. So out of all of them, only the first choice is the best choice. Now the next one, which of the following statements are true with adverse drug reactions? Let us analyze one by one. See, any response to a drug which is noxious and unintended, it is called as adverse drug reaction. Noxious means harmful, unintended means it is not of therapeutic use. Intentionally we give drugs to treat a therapeutic condition, and unintended means which is out of the therapeutic value. Next one, which occurs at doses normally used in man for prophylaxis, diagnosis or therapy of a disease. See, adverse drug events usually occurs at normal doses. That is what is called as adverse drug reactions. Now the next one, adverse drug reaction is same as that of adverse drug event is same as that of adverse drug reaction. No, this is not true. Both of them are different. See, adverse drug reaction occurs in normal dose, whereas adverse drug event may occur in abnormal doses. When someone takes a medication for suicidal tendencies, that is considered as adverse drug event. It is not in normal doses. So this is not true. Now, other option, which occurs at normal dose or overdose when used for prophylaxis. See, this is what is the definition of adverse drug event. So adverse drug event means an adverse reaction which occurs at normal dose or overdose when used for prophylaxis, diagnosis or therapy. So this is called as adverse drug event. So these two are not true with respect to adverse drug reactions. So you are left with only the first and second options, A and B. So look at them. A and B are true while C and D are false. So this is the answer. Going to the next one. Now we need to match the list 1 with list 2. Now see, all these are anti-immunosuppressant drugs. Now look at them. The first one, anakinra. See, anakinra is this one. Interleukin 1 receptor antagonists. These are called as disease modifying anti-rheumatic drugs. So interleukin See, rheumatoid arthritis is because of immune system aggression. So to control that immune system aggression, interleukin antagonists are used, and IL-1 interleukin 1 receptor antagonist is anakinra. Now the second one, basiliximab, is also an interleukin receptor antagonist, but it belongs to interleukin 2 receptor category. Usually it is also used in cases of organ rejection or tissue transplantation. To control immunity, basiliximab is preferred. Now infliximab, see, infliximab is tumor necrosis alpha inhibitor. This is used to treat, again this is also used to treat many immune aggression autoimmune diseases like Crohn's disease, rheumatoid arthritis, and to cause immunosuppression. Now the next one, tacrolimus, is calcineurin inhibitor. Again it is a potent immunosuppressant. So all these drugs are immunosuppressants, but the mechanism of action differs. Anakinra is interleukin 1 receptor antagonist, basiliximab interleukin 2 receptor antagonist, infliximab tumor necrosis factor inhibitor, tacrolimus calcineurin inhibitor. So this anakinra is 5, so this one. And see, two options are there. Now second one, basiliximab is what? Interleukin 2 receptor antagonist, so this one. So once you find out this one, the remaining things will be correct. So this is how you need to deal. In the previous lecture also I have explained this technique. You know one thing perfectly, that can match the following questions. Okay, moving to the next one. Now, which of the following are not true? Look at this word, not true, about Parkinsonism disease. Now, Parkinson's disease is caused by degeneration of substantia nigra. Yes, this is true. Parkinson's disease is caused by degenerative loss of nigrostriatal dopaminergic neurons. This is what is there in Parkinson's disease. Bradykinesia, rigidity, tremor are the main symptoms of Parkinson. These are called as triad of Parkinson's 3 symptoms. Now, Parkinson's disease is caused by degenerative loss of nigrostriatal cholinergic. No, it is not cholinergic, it is dopaminergic neurons. So the question is about, you need to find which one is not true. So this D is not true. All the 3 are true. So the option is D only. So this is what is the option. Moving to the next one. Now, which of the following clinical feature is not responsible for insulin resistance in type 2 diabetes? See, type 2 diabetes is either because of reduced insulin or insulin resistance. Insulin resistance is caused by lipids. Now, again in this lipids, you need to understand certain things. See, LDL is considered as bad cholesterol because it gets accumulated in the cell and cause all the problems. Whereas HDL is considered as good cholesterol. See, always this bad cholesterol level should be low and HDL should be high. This is the ideal condition. If LDL is high, there is a chance of causing insulin resistance. See, which of the following clinical feature is not responsible again? What is not responsible? Increased LDL, yes, it causes lipids and it causes increase in lipids, bad cholesterol, and it results in insulin resistance. Increased HDL, no, increased HDL is good cholesterol which is required. Now, reduced HDL, now I can see, you need to have this thing, LDL should be low as possible, HDL should be as high as possible. If LDL is low, that also causes insulin resistance. Increased triglyceride also causes insulin resistance. So only feature that is not responsible for insulin resistance is increased HDL. Increasing HDL is increasing good cholesterol, which will enhances the cell activity and reduces insulin resistance. So this is the answer. Moving to the next one. Now, which of the following statement is true for periosteum of the bone? See, the outer layer of the bone is called as periosteum. Now, periosteum has got multiple features. Let us see one by one. See, it protects the bone by assisting in fracture repair. Yes, it will be on the top of the bone, so it tries to protect the bone from the fracture. Next one, it has osteogenic cells which enable bone to grow in thickness. See, the thickness of the bone is because of these osteogenic cells which are present on this periosteum. This is true. It is composed of an outer fibrous layer. Outside there is a fibrous layer is there. It is dense and irregular connective tissue, and inside, inner osteogenic layer, this is what is osteogenic cells is. Inside you have osteogenic cells are there. So this is the composition of periosteum, outside fibrous, inside osteogenic cells. This is also true. So which of the following statement True for periosteum means all of these options are true. So this is about periosteum. Now, nitric oxide synthase exists in, see, nitric oxide synthase is an enzyme and it has got three forms are there. Nitric oxide synthase inducible, nitric oxide synthase endothelial, nitric oxide synthase neuronal. There are three isoforms are there. So nitric oxide synthase exists in three isoforms. So option this is the right one. Now understand this question. A patient with pheochromocytoma is undergoing surgery and has not been administered with alpha receptor blocker. If he has been administered with intravenous propranolol, then which of the following effects will be evident? See, pheochromocytoma is nothing but adrenal tumor. Now, in case of adrenal tumor, there is an excessive release of adrenaline. Now, when adrenaline is released, it will be acting on alpha receptors as well as beta receptors. So excessive stimulation of alpha beta will be there, but propranolol is administered, so beta responses will not be there. What is the alpha response? Alpha 1, vasoconstriction, severe increase in blood pressure will be there. Look at the answers. There will be a rise in blood pressure. This is the correct answer. There will be fall in blood pressure? No, there will be a rise. Blood pressure will not be changed? No, it will change because excess adrenaline will be acting on alpha receptors and increases blood pressure. Patient may suffer severe vasoconstriction? No, it won't be there because beta receptors are blocked. It won't be there. No, so there will be a rise in blood pressure. So option, this one is correct one. So this is about a set of pharmacology questions. Remaining questions, key explanation will be done in the next video. Thank you for watching this video. If you like the video, do subscribe and share.